The first chest X-ray, chest radiograph of an adult male patient showing a moderate-sized left-sided pleural effusion with mediastinal shift, with ipsilateral mediastinal shift. Once you see a pleural effusion on chest X-ray, you need to look for 3 signs. Signs of inflammation, signs of primary tumor or mesothelioma, and signs of secondaries or metastasis. Signs of inflammation: no other lesions can be noted on the underlying lung. No lung lesions in the right side, and no pleural effusion. No mediastinal lymphadenopathy. Then we need to look for signs of mesothelioma. Mesothelioma is a primary tumor, occurs on top of asbestosis. So you need to look for calcified pleural plaques. No calcified pleural plaques. No calcified pleural plaques seen. Then you need to look for bony metastasis. No lytic or destructive bony lesions could be noted. In summary, there is a unilateral pleural effusion with loculation. Differential diagnosis for the appearance includes inflammation and empyema, primary tumor, mesothelioma, secondaries, and pleural metastasis. I would urgently contact the referring clinician. Lung infection needs urgent contact of the referring clinician. So I would urgently contact the referring clinician to convey the findings and to recommend. Correlation with inflammatory markers. If the inflammatory markers are high, so empyema is the most likely diagnosis, and I would recommend urgent respiratory unit referral to start the antibiotic treatment and repeat chest X-ray after treatment. So if the inflammatory markers are high, this is empyema, so I would urgently start the treatment. Urgent referral and urgent treatment. Start the antibiotic treatment and repeat chest X-ray follow-up chest X-ray after treatment, plus consideration for drainage. Consideration for drainage. The treatment includes antibiotic treatment and drainage of the pleural effusion. If the inflammatory markers are normal, so primary and metastasis would be considered. So neoplasm, including mesothelioma or metastasis, will be considered. So then I would recommend a CT scan for further assessment. I would recommend a CT scan for further assessment. This is the second case of pleural effusion, chest X-ray with chest X-ray showing a moderate-sized left-sided pleural effusion. Once a pleural effusion is seen on chest X-ray, you need to comment on other inflammatory signs, other signs of neoplasm. But here, the moderate left-sided pleural effusion is associated with right-sided mastectomy, evidence of right-sided mastectomy. This is the left breast shadow, which is intact. Here, there is evidence of right-sided mastectomy and evidence of a central venous line. So, this appearance is suggestive of a breast cancer patient under treatment. A central venous line is used in cancer patient for chemotherapy. So this is a breast cancer patient under treatment with development of a moderate left-sided pleural effusion. With this pleural effusion, you need to look for other signs of inflammation. No lesions in the underlying and on the contralateral lung could be noted. No right-sided pleural effusion could be noted. You need to look for signs of mesothelioma. Mesothelioma, as mentioned before, usually occurs on top of asbestosis. So you need to look for calcified pleural plaques. No evidence of calcified pleural plaques. You need to look for evidence of bony metastasis. No lytic or destructive bony lesions could be noted. Differential diagnosis for the appearance. This appearance includes an empyema, inflammatory cause, an empyema, neoplastic cause, mesothelioma as a primary tumor, and pleural metastasis. In my normal practice, I would compare with all the chest X-ray to see if this is a new finding. Why I said this sentence here and I didn't say it in the previous case? Because in this case, the patient has evidence of right breast mastectomy. So, of course, he has previous chest x-rays before and after mastectomy. So, it's expected here to find previous or old chest x-ray. So in my normal practice, I would compare with old chest x-ray to see if this is a new finding. If yes, I would recommend correlation with inflammatory markers. So if the inflammatory markers are high, emphysema is the most likely diagnosis. So I would urgently contact the referring clinician and recommend urgent respiratory unit referral to start the antibiotic treatment and a possible drainage of the pleural effusion with a repeat chest x-ray following treatment. If the inflammatory markers are normal, so neoplastic causes is the most neoplastic cause is the most likely diagnosis, including mesothelioma or metastasis. Then I would recommend a CT scan for further assessment.